got a diagnosis about a year ago, bipolar II. Something will happen, it'll crash, and then, it's just a week of sleeping for 16 hours a day. Very depressed, just can't get up, can't get out, very embarrassed, just feel like I'm not in my body.
All this busyness can be associated with bipolar. I think it's associated with the trauma, and the more trauma work you do, probably the better. So let's talk about bipolar disorder. Typically, you have periods where you're...
Sedona Prince is an American basketball player who plays for Panathinaikos in the Greek Women's Basketball League.
Negativity bias, 36. That needs to be better. That makes you more vulnerable to depression if your brain goes to what's wrong. Start every day with today is going to be a great day. End every day with what went well today. What's a bad thought that's going on?
I'm gonna get re-injured.
5 questions. Is that true?
Every day you are making your brain better, or you are making it worse. Stay with us to learn how you can change your brain for the better every day. Are you excited to optimize your brain and help the brains of those you love? Do you want to prevent or treat memory problems, anxiety or depression? Do you want to be happier? That's why I created Amen University, to take what I've learned over the last 45 years and help you have a better brain, a better mind, and a better body. You can take courses like our 30-day happiness challenge, which was shown in research to increase happiness by 32% in just 30 days, or memory rescue, or overcoming anxiety, depression, trauma, and grief, or healing ADD at home in 30 days, and much more. We also have professional courses and courses for kids, including Brain Thrive by 25, which was found in independent research to decrease depression and improve self-esteem. And as a special offer just for our listeners, you can save 20% on your next course. Visit amenuniversity.com and use the code podcast20.
So I'm very excited about this week's podcast. We have Sedona Prince, who is a basketball player who played for the TCU Horned Frogs of the Big 12 Conference. She previously played for the Oregon Ducks of the Pac-12 Conference and the Texas Longhorns. At 6 feet 7 inches, she's one of the tallest players to ever play for Oregon. One of the tallest players ever to play for anywhere. Prince generated national attention in 2021 after highlighting the disparity in facilities between men's and women's NC2A tournaments. February of 2025, she helped TCU achieve its highest ranking ever. Prince signed with Al Riyadi of the Women's Lebanese Basketball League in May of 2025. Being Lebanese, I'm very excited to watch you play. And you've been public that you've had some brain and mental health challenges. So welcome. Yeah. I'm very excited to meet you. I've seen your brain. We're going to talk about it a little bit. What's your goal in being here?
Yeah, I have struggled a lot for a long time, as being an athlete, a lot of different challenges, and just, it's been a very silent struggle, I think. Been a long journey of just a lot of confusion about what is going on, right? A lot of misdiagnoses and just medications. And I just want to be, healthy and happy. And I think that will translate to basketball, right? My body is my job. I take care of it as best as I can. And I think that a lot of athletes don't consider that your brain is, the biggest part of that. And so I kind of just want to dive in and see what I can do and kind of heal from the traumas that I've been, through in sports and just become the healthiest, happiest person I can be.
So what was it like being the tallest girl?
Being the tallest, I actually grew up in a very small town in Texas. Very conservative, like very small. We moved there, it was population 900, like tiny town. And so it was, first isolating is just that is a very strange thing, being a young girl, just trying to fit in and being so unable to. I was taller than my coaches at like 12 years old, a foot taller than even the tallest boy growing up. And that caused also a lot of bullying, right? It was very different. Everyone knew I was different. A lot of bullying within my basketball team, right? Which caused a lot of different things and dynamics throughout sports with me, throughout my teammates, and just a lot of just very triggering things, right? Throughout my sports career. But yeah, I mean, it was, I used to compare it a lot to like tell my parents, which is very heartbreaking as a young girl. I would tell my mom, like, I feel like my world is dark, right? And the road to college, like college is my white light, I just want to get out and just I just need to push through this time in my life, which is my childhood, right? It's supposed to be like fun and growing and like this, so many good memories. And just sad to think back on that. It's like, that was just, my reality for so long.
Well, people say it's supposed to be that. So it's public knowledge. I treat some really wonderful, interesting people like Miley Cyrus. And I just remember with one of them that like were mourning their childhood. And I'm like, being a teenager sucks.
Yes.
It's like,
Yes.
It sucks for most people.
Yeah, exactly.
I said, you were like performing in Australia.
Yeah.
It's
Yeah.
like,
Yeah.
But I don't think that gets talked about enough, that girls that are tall often feel isolated and alone.
Yep.
And it can be really hard for them.
Yep.
Now,
I've heard
you
from
were tall, but you were also excellent at playing basketball.
Yes.
And did you
tall.
like basketball? Was that a fun thing for you?
Yeah, absolutely. Yeah. I played volleyball as well. But yeah, I mean, it's kind of a thing too at a young age where, I'm 6'7" at 15 years old. Right. And, right. And it's a decision that, okay, this is something I could legitimately pursue a career in. Right. That's when it started to become really serious for me and kind of like a job at 14.
Amazing.
Yeah.
When were you first diagnosed?
After my sophomore year, I was diagnosed first with depression, anxiety.
In high school?
No, my freshman year, sophomore year in college.
Sophomore year in college.
About 2019. Yep. Diagnosed with depression and anxiety. I'd gone through a really traumatic leg injury, had broken my leg, been through a really rough process. I got re-injured. My leg died.
Did you break it in Mexico?
I did break it in Mexico. Yeah, Mexico City.
And then you had to come home by yourself.
Yeah, stuck there for 2 days alone. Had to come back, fly commercial, actually with a broken leg. It was a crazy story, crazy process. Had surgery, was rushed back too fast in my sport. And my leg ended up, the blood vessels were compacting at too early of a stage. And so my leg died, my tibia died, became necrotic, and then it became infected. And so I had to fly to New York. My whole leg from my knee down is held together by a big plate. And so it was crazy. I was on a PICC line for 5 weeks, pumping antibiotics as I'm a freshman in college, have a ball of antibiotics in my hand while I'm sitting in class. Crazy journey. I couldn't walk for the better part of almost 2 years. It was crazy. And also losing my sport, Yeah.
Yeah. I mean, because you had targeted so much of your joy and your energy and your hope.
Yep.
And all of that becomes at great risk.
Yep. Yeah.
So that must have been very traumatic for you.
Yeah. Crisis. Yeah, definitely.
So no wonder the anxiety and depression. Was the anxiety and depression around earlier?
I've
or
thought,
not so much?
I don't think so. I've thought back to it. I think that it started when I started to have like really traumatic, like that was the first time when I broke my leg. It was like, that was a trauma that I went through. And then I didn't even realize it was that big of a trauma, right, in the time. And then all these things started coming, like the depression, anxiety, and kind of these manic, behaviors and stuff. And I didn't realize what was going on. I couldn't even in that moment be like, hey, something's up, right? I just knew that something was wrong. But no, early in my life, I was, never really struggled. Some anxiety, some communication problems as a young girl, right? Going through being bullied every day and not being able to express that, my life is horrible. I am miserable every day I go to school, right? But yeah, it started after that leg injury.
Because I know you've had a number of different diagnoses.
Mm-hmm. Yep.
And you just wonder about them, if maybe so much of it is trauma. And then an unhealthy brain from all the antibiotics. People don't think about antibiotics in the brain, but you have 100 trillion bugs in your gut, and that's called the microbiome, and they make neurotransmitters, and they detoxify your body, and they help you with hormones. And if you get all of those IV antibiotics, they're damaging the bugs, which means your microbiome might not be as healthy.
Yeah. I actually got poisoned by the antibiotics. I had to stop early because it almost made me go into kidney failure. So it was poisoning my body. So I can imagine that it did some serious damage.
Yeah. Because when I show you your scan, emotional trauma is going to be the number one thing. That you actually have a pretty good looking brain. When I read your history and then I saw your scan, I'm like, she has a good looking brain. I bet no one's ever told you that before. And so, but it's very busy. And when I see that, it generally is where trauma sort of got stuck in your brain, which can then lead to all sorts of behaviors, which we'll talk about. What was the turning point that made you want to sort of seek deeper answers?
I think I recently restarted medication for bipolar, and I got a diagnosis about a year ago, Bipolar II. And I felt like I didn't have enough answers about it. I felt just really confused about what that meant, my moods and the medication that I was on. Like, I was just so much confusion, right? And so I just wanted to know deeper and what's exactly going on. I've had struggles. I had a very long college career, 7 years. A lot of trauma was built up in that. And I'm at a point in my life now where it's heading into my professional career, right? So it's a decision to make. It's, do I take care of this now, or do I let it continue, to affect me as a person, as a player? And so it's kind of the perfect opportunity before I transition into the next phase of my athletic career, is to digest everything that happened, throughout the 7-year crazy college experience I had.
So let's talk about bipolar disorder, or bipolar II. It's a cyclical mood disorder. And typically you have periods where you're down, sad, and periods when you're really up. And you can be down for months at a time and up for weeks or months. Is that what happens to you? What were the symptoms that caused your doctor to go, I think you have bipolar disorder? Yep.
I go through it's about a week or two, a week and a half. This phase where, it could start with anything, triggers me into kind of like these highs, right? And through that, I've made some really bad decisions, been really impulsive, that have affected my basketball career as well, right? Injury wise, and also being in the public eye, right, throughout my college career. And then something will happen, it'll crash, and then, it's just a week of sleeping for 16 hours a day, right? Very depressed, just can't get up, can't get out, very embarrassed of myself, and just in these states where I just feel like I'm not in my body, right? And that's when I kind of knew, and also I didn't know if it was, do I have this? Because I never always struggled with this. Is this something that is real and it's, a part of me, or is it something that's trauma related, right? And came from the trauma that I've been through.
And do you have anybody in your family, on your mom's side or your dad's side, that has a serious psychiatric problem?
No, I mean, have some issues, a lot of childhood trauma for them, right? But and a lot of undiagnosed, right? So we don't know. I don't want to diagnose them, but they've struggled with a lot of things, right, in their past, in their childhood, some addiction issues and stuff that they've gotten through, but nothing like bipolar, nothing like this, kind of what I struggle with, the symptoms.
And so with bipolar, when I think of mania, I think of you don't need to sleep and your thoughts go fast, and you can begin to believe things that are not rational when you're in your sort of sane mind. Any of that happened to you?
Yeah, a lot of I've taken flights before, in the middle of season, right? Just this thought that comes to my head is I have to do this. I have to go and do something. And it's chasing this kind of not high, but it is a high on this excitement, right? And that comes with impulsive decisions, right? Spending, and with NIL and this new era of college athletics, right? And being able to make money, it's very crazy for me, this shift. And all of a sudden overnight, I was able to make all this money and then dealing with all these things. And it was just kind of the perfect storm to make some really crazy decisions.
Interesting.
Yeah.
In your therapy, you have found EMDR helpful.
Amazing. Yeah.
How many times have you done it?
Done it for about a year now. Every week, 1 day a week.
I love EMDR.
Yeah.
So for people who don't know, it stands for eye movement, desensitization, and reprocessing. And you bring up whatever's triggering you, whatever's bothering you. You do the EMDR. And then how I do it is I get people get on a train and go back to when it began. Is that similar to what you do?
Yeah.
So helpful because it just cleans out a lot of the triggers.
Yeah. It's been eye-opening to go back to as well, the leg injury itself, but also, I had elbow reconstruction, a lot of crazy things. I was out of college sports for a year, right? And so a lot of this crisis that I went through in many different areas and different years, I was able to kind of look back at it from a different perspective, a different lens being later in my life. I think the biggest thing I learned was having so much empathy for myself, right? And what the things I've been through, forgiving myself for so many things and just seeing myself as a young girl going through all these things for the first time at an outside perspective and being wow, I'm so sorry to this young girl that I put so much pressure on, right? And just thought that I was bulletproof. And, it was a crazy experience just feeling, almost bad. I'm I feel so bad for this girl that, had to go through all these things.
If you looked at your 10-year-old self, how would she feel about how you're doing now?
I mean, I would be mind blown, I think, right? Being from a very small town and, I did not fit in, very just dorky and shy and kind of the goofball and the outsider of my life, to looking now of being someone that I walk around in public and recognize people, look up to me, young girls in my sport when I was that age, thank me for the work I've done in women's sports, right? It's just, I wouldn't believe it was true. I don't think.
So you'd be pretty amazed.
Yeah.
You're oh, whoa.
Yeah.
So she would be very proud of you.
Yeah, absolutely. Yeah.
I love that so much. I've been waiting for this. Our best-selling L-theanine gummies are finally back. I take them for calm, focused energy, and they taste amazing. They sell out fast, so grab yours now at brainmd.com with code podcast20 for 20% off. So part of our process is we test your brain and then we look at your scan. I was telling you before we started, psychiatrists are the only medical doctors who virtually never look at the organ they treat. And so to have multiple different diagnoses with no one looking at your brain, that's insane. And I'm a psychiatrist. I was taught to diagnose crazy, and that's crazy. Because the first thing I'd have done is let's look at her brain to see what is going on. So we do a study called brain SPECT, SPECT imaging. And SPECT looks at blood flow and activity. It looks at how your brain works. And it basically shows us 3 things: areas of your brain that work well, areas of your brain that are low in activity, and areas of your brain that are high in activity. And then my job is to balance it. If it works too hard, want to calm it down. And if it doesn't work hard enough, we want to stimulate it. And when I read your history, I'm like, your brain is going to struggle because you've really struggled. So here we're looking at the outside surface. Here we're looking underneath the brain. This isn't yours. This is what we want it to look like.
Okay.
And this is down from the top, one side, then the other side. And it should just be full, even, and symmetrical. So I'm going to show you that view. And then this is going to be the money view for you, or the one that really matters. So here we're looking underneath the brain. Top is the front. This is the back. And blue is average activity. Red is the top 15%. White is the top 8%. So white's like the super active. And it should be here in the cerebellum, which is in the back bottom part of your brain. And you're a professional athlete, and that should be really busy because that's involved in coordination, reaction time, thought coordination is really important. When we look at your brain, so again, looking at the outside surface, I mean, you have a very good looking brain.
Thanks.
It's a little bumpy. Do you see the bumpiness?
Yes, I do.
So I don't like the bumpiness. And when it comes to things like alcohol, marijuana, kratom, you got to get rid of those. You want a sustained, long-term career where you're making good money and having fun. You can't poison your brain. All of those things are poison. And the one question I want you to leave here with, that I want you to ask yourself every minute of every day, is this good for my brain or bad for it? Because I want you to love your brain. And you have a great brain, right? No one's ever told you that before, but you have a great brain. This is a brain that can do anything. Okay? The problem is your brain works way too hard. We'll get to that in a second. And so you're probably constantly trying to shut it down because it's bothering you a lot. Shut it down. Alcohol shuts it down. Kratom shuts it down. Marijuana shuts it down. But they're terrible for you because they're toxic. And as soon as you do them, you're going to be in withdrawal in a couple of hours, and you're going to have to do them again. They're insidious, and that they make your brain crave them. And so they're trying to steal you. So if it was me, I would see them as the devil. And stay away from them.
Yes, sir.
That's a little bit of bumpiness, but nothing's permanent. You don't have permanent damage from anything. All right. So if we go here, your brain is frickin' on fire.
Wow.
Your cerebellum's beautiful. So that's not the problem. Your emotional brain's high. That can go with depression, anxious, angst, feel just really uncomfortable inside. It's probably true.
Yes,
right?
Yep.
And you worry and you hold on to things. And if things don't go a certain way, it pisses you off.
Yes.
Am I right about that?
That's correct, yeah.
Okay. And it's in a trauma pattern. And I bet if I had this before the 50 sessions of EMDR, it'd be even crazier or worse. Because that's what EMDR does. It calms it down. So even if you're in Europe, I'd have a really good connection with your therapist and keep doing it. And anytime you get a trigger, write it down. Especially if you do what I say and you just get rid of the substances. You know, I always tell my patients, let me do your drugs. I'm better at them than you are. And for this brain, I actually quite like Lamictal, which is what you're on. How much do you take?
About 150 milligrams right now. I was at 250 at one point, but yeah.
And why did you go down?
I just got with a new psychiatrist and we restarted. And so I went back up.
Okay. So I would get a lamotrigine level. So lamotrigine is the generic name of Lamictal. I would actually get the level in your blood and I would target mid to high range just to calm this thing down. Yeah. So you're not having to calm it down with other things.
Yep.
Actually just did a show with KTLA. It's a big news station here in LA. I scanned the anchor and the producer. And then a year later, I scanned them again. And not the anchor, the weather person, Casey Montoya. I love her. Her brain was so much better because she just did what I said.
Yeah.
The producer's brain was worse, which really made me unhappy. And I'm like, why is it worse? He goes, I don't know. I'm doing what you said. He picked up kratom from his first scan to his second scan.
There you go.
It's not a good
No, it's
thing.
not good. Yeah. Yeah.
And I'm not happy it's legal
because,
I mean, it's basically an opiate.
Yeah, literally,
All this busyness can be associated with bipolar disorder. I think it's associated with the trauma, and the more trauma work you do, probably the better. But I agree with you. If you're going overseas and you want to be stable, have a really good doctor you're working with, and do what he or she says, and plus in those countries, those kinds of drugs will get you into a whole bunch of trouble, as we saw with another WNBA player.
Yeah, another very tall.
I got her into all sorts of. What's legal here is not. Legal there for sure. Is your goal to come back and someday play in the WNBA?
Yeah, of course. Yeah, it's been a childhood dream of mine. Wasn't the right timing now, but it's been, that's the goal, right? As a young girl, that's what you have put in. My goodness, I count thousands and thousands and thousands of hours at this, since I was 10, 11. It's my life and I love it. I have a gift. I get to, play a sport that connects me with people, and I get to use my platform to make change and talk about really cool things. And so, it's my goal is to, improve the WNBA and bring more attention to it, right? Attention to a lot of the things that I, brought attention to in the NCAA, right? Same kind of things going on. If there are, then, use my platform in the same way that I have been for a long time.
Love that. Have you gotten any mental health training for sport?
Not really. And I talked about it before coming here with one of my best friends. It's kind of crazy how, thinking about it, being in college sports for 7 years, right? And being at 3 different schools, and also meeting a lot of different athletes, being on a lot of different, athletes teams, right? I've had so many different teammates. It's crazy how they treat college athletes' mental health, right? It really is just, let's give them that quick fix, medication, right? Give us, your symptoms. Okay, get you meds, because have you for 4 years and you're there to perform, right, at a certain level. And so they need you to perform at that level, and it's kind of just like, and then when you're gone, you're gone, and that's that, and then it's good luck, into the real world, and then. As a college athlete, you're stuck with, okay, well, I'm taking this medication. Is it right for me? Like, why did I get prescribed it? I was young. I was going through all these different things, this, very difficult college athlete life, right? And it is very much, there's not very many like mental health resources, just psychiatry and medication, right? Let's fix it. Let's get, you feeling better, get you back on the field, back on the court. And then that's something you're going to have to deal with, when you're on your insurance plan.
Do they do any elite mental training or not?
We do some here and there.
I mean, TCU's an elite school.
Yeah.
And I mean, all the schools you've been to are high level schools. In 2 weeks, Julius Randle is going to be on our podcast.
Wow, how awesome.
And I love him so much.
Yeah.
And we're going to talk about the alter ego effect. Have you ever seen the book, The Alter Ego Effect?
No.
You should read it.
Yeah.
It's so good. And I heard about it. We had Todd Herman on the podcast. And I was watching a documentary on Kobe Bryant. And Kobe Bryant's alter ego was the Black Mamba. And he talked about the book. And so I got the book, I read it, and I'm like, well, all athletes should have an alter ego.
Yeah.
That when they like step on the court, it can't be all their failures and worries.
Yeah.
Right? It has to be like the Black Mamba.
Yeah. Yeah.
So you should listen to that podcast. I
Yeah.
think you'll like it. But I would also get the book because it's really good with elite mental training. Like every day you win or you learn.
Yeah, absolutely.
And why the NBA allows their players to smoke pot and then go play. I'm at a loss.
Yeah, it's performance. Yeah.
Marijuana does not speed up your brain.
No. Yeah. Yeah.
I mean, one could argue, I certainly would understand why you would, but it's not going to get you what you want. Getting to the right dose of Lamictal can be really helpful. And then doing the trauma treatment could be incredibly beneficial. We also tested your brain. We did an X test, sort of an ADD test, and you sure did okay on that. But this one is called Total Brain, and you're good at recognizing faces. You recognize positive faces faster than negative ones. If you get your feelings hurt, it sort of sticks around a little bit. You're under a lot of stress now. Is that accurate?
Yes. Yeah.
And you're sort of depressed now.
Yeah.
Let me give you something called Happy Saffron. 28 randomized controlled trials showing it's equally effective to antidepressants. Will not flip you into a manic episode like some antidepressants might. But it also helps with focus and memory. Because I think that's important to treat. Lamictal at higher doses also has antidepressant qualities. So I like that. Your long-term memory is great. Focus here, not so much. And you also take Concerta? Why?
Yes. I stopped, but I did for a while. I was diagnosed ADHD probably 2020 after, some of my staff at Oregon were like, hey, we think you have ADHD, right? And so I got the test and they gave me medication and it helped for a little bit, but then it made my manic episodes so much worse, right?
It's so risky. With your brain, you don't have an ADD brain.
Yeah.
You have a busy brain. Usually ADD is a sleepy brain. Your brain is not sleepy. It's like, hey, what's going on?
Yes.
Planning is good. Your processing speed, I don't think I've ever seen a 98. It's really good. That's what a professional athlete would have. I don't know if you know, but I did the big NFL study when the NFL was lying. It had a problem with traumatic brain injury. So we've seen 400 NFL players.
Wow.
And their processing speed was like this, always great. Flexibility, not good. So I want you to learn the rule of 12. I don't get upset until the 12th thing has gone wrong. So if you need to work on flexibility, you do. You need to have a program. And the rule of 12 is just perfect. It's like you're competent, you're capable, you've been around the world, you can handle problems. And so when something bothers you, it's like, okay, that's one. And you cannot get upset, yell, scream, have a fit until the 12th thing has gone wrong. And then you can. It's so helpful. Short-term memory is fine. Negativity bias, 36. That needs to be better. That makes you more vulnerable to depression if your brain goes to what's wrong rather than goes. I have people that score 1 or 4. So 36 isn't terrible, but it's not good. Start every day with today is going to be a great day. End every day with what went well today. So every night I say a prayer and then I go, what went well today? And I start hour by hour going through my day, looking at only what went well. And the bad stuff shows up and I just kick it out because I'm like, not now. Deal with you tomorrow. It helps so much to begin to just train your brain. Because, right, whatever you allow it to think, it's going to think over and over and over because your brain is lazy, which is why you practice, right? You shoot free throws over and over and over again. Yeah. So when it's an important point in the game, you make them because your brain knows how to do it. Same thing's true with thoughts. Whenever a negative thought shows up, if you allow it there and you don't take care of it, they create these little grooves in your brain. So unlike positivity training, today is going to be a great day. What went well today? Your resilience can be better, but you're very social, which is awesome. Questions? That's a lot.
Yeah, a lot of questions.
That's a lot.
Yeah, it's so super cool. It's very precise. I like it. It's insane, I think to see my brain too, it's, I was really scared coming in just because, been through a lot
me too with some of the stuff you've done. But you've not had a big head injury in your career.
Thank God, no. I've not gotten any, I've balled to the face here and there, coming off the rim really hard. But other than that, no, falling down or hitting my head, which is very common in basketball. And so it helps them so high up too, right? I don't really get elbows to the face. I'm the one usually giving them, so.
And what's your position usually?
Center. Yeah.
All right. So repeat back to me what you heard me say about your brain.
Very active, which it makes so much sense. I knew that coming in, right? It's like, there's so much going on. It drives me nuts. It's like I can't escape my own head sometimes, right? And it's just so exhausting. It never can stop, right? And I think that's why I got the ADHD diagnosis as well. It's like, it's constantly going. And I think the people around me didn't understand like what was going on with me. And they just assumed it was ADHD because that's what they've heard about. But yeah, it's kind of like I'm stuck in like, or have been for a while, like a prison of my mind, right? And it's exhausting. It's overwhelming, right? And even when I sleep, it's just I'm so active, which I see here in like the 12 step. I love that, right? And a lot of things do not go right a lot of the time. And I've learned to just kind of like, just become numb to it, right? Not even accept it or process it in time. Like I just ignore it and like kind of disassociate from it. And it's not real, right? Which I think then I'm not processing it in real time, right? And it's been a struggle for me as well. It's like, then later down the road, I look back at it and I'm like, oh my goodness, right? And then I make decisions from it based off of it. This emotional things that come up from the things that are going on around me. Instead of realizing, this hurts, right? This went wrong. I'm upset with this. Let me deal with this and these emotions in real time. It's not like that. It's like, put that away, right? It didn't happen. It's not real. Or I'm fine. And, I'll make it through it.
Give me an example.
Let's see what year, 2022, I was going into what would have been my senior season at University of Oregon. Super excited. It's supposed to be like my year, I'm gonna get more playing time coming off, I'm going to get, a lot of more minutes. I'm really excited for the season. It was a great year. It was kind of like going to be like my breakout season before WNBA. And about a month before the season started, I went line dancing with some friends and I tripped over a curb, dislocated my elbow, and that was it. Dislocated it, tore the top ligament, and it was needed a full reconstruction on my elbow. And that was it. I like literally in real time was like, it's not real. Like I had just lost everything, right? Going through this crisis, and I couldn't be there anymore. I couldn't even face like my teammates. I couldn't be in that space that I was supposed to have the season of my life, right? And within 2 weeks, I left. I moved down to LA, got surgery, and just kind of started a new chapter of my life, right? Without even processing it, without talking about it. And coming off of years of not ever talking about my leg break. I never talked about it with anybody. I just kept going through these things, right? And just processing them. I'll get to it later, right? It's not affecting me. I'm super resilient. I'll be fine. I'll get through it. And then I look back and I'm like, I was going through a crisis. I was having all of these emotions, right, without even understanding what they were. Sleeping all day, right? My brain was going of like, I've just lost everything, right? My life is over. My career is over. Everything I've worked for. So much humiliation of like, the injury was my fault. I could have saved my career, right? I'm going to look back at this for the rest of my life and just regret this for forever, right? Beat myself up for this. And these are things with EMDR that I've now been able to process, right? Without EMDR, I was so unaware of all of these things going on, right? All things that
because no one had ever taught you to manage your mind.
Yep, correct.
Right? That everybody has accidents. It's not your fault.
Mm-hmm.
It's a freak thing. What can I do? What's next?
Mm-hmm.
Right?
Yep. Yeah.
I like Ariana Grande's song, Thank You, Next. And I'm friends with her, and I texted her when I listened to that song, because, it's sort of like a silly pop song, until you realize it's mental health in 3 words. Gratitude for whatever happened, looking forward. So thank you, next. Gratitude, looking forward. And yeah. And with the EMDR, that'll help. I have a process I teach my patients called killing the ants, automatic negative thoughts, the thoughts that come into your mind automatically and ruin you. And a long time ago, I coined the term ants because I'm like, oh, my patients are infested. So they need an anteater. Yeah. And so whenever you feel sad, mad, nervous, or out of control, write down what you're thinking. And then just ask yourself whether or not it's true. But the act of writing helps to get it out of your head. How do you do in school?
Great. I had my master's. I just finished up, actually.
In?
My master's in liberal arts, and then I got my business degree from University of Oregon. So,
okay, that's sort of not ADD.
Yeah, right. Yeah,
right.
Yeah.
I mean, you're able to focus and.
Yeah, for the most part, yeah. I can track here and there, and it's just because my brain will start hopping to different thoughts, right? Of even not thoughts about my life and things that are going on, right?
Yeah, I'd be very careful with the stimulants.
Yes,
I'm not convinced ADD is.
Yeah,
I think, and. I wrote a book called Healing ADD about 7 different types. And if you had one of them, it would be the ring of fire, which is stimulants usually make worse. When you calm this brain down. It's like, let's calm this when you're anxious, and not with alcohol and not with kratom and not with marijuana. Yeah. I make something called GABA calming. Like if you're like feeling anxious, theanine from green tea can be so helpful, or GABA calming. I'll give you some and try it. Tell me what you think.
Thanks. Yeah. I took Adderall for about 2.5 years during the middle of the season, right? And it's very difficult to have intensified manic episodes on Adderall in the middle of a massive college basketball season, right? And hiding it, I think masking it, I had to. I had coaches and stuff like, they knew I'd make, dumb decisions, and they'd be like, oh, come on, Sedona, like get it together. You're, what are you doing? All this stuff. And I've been diagnosed something that was literally just heightening my episodes. And then, I'd go for days without sleeping in the middle of the season, right? I'm a professional athlete. I work out 4 hours a day, every day. Right. And then imagine that was doing my body. Right. And then a week and a half, I just crash and just be devastated, right? In the middle of every day having to wake up and go to practice and be a teammate and a leader and a captain, right? And be a part of a team unit, for a common goal.
Yeah, we should have met like 10 years ago.
Yeah, right.
We should have met 10 years ago.
Yeah, that would have saved me a lot of struggling.
But, every day, I want you to think about this. Every day you win or you learn. And if you have that mindset, there is no failure. It's just every day you win or you learn. And it's just the right mindset to have as a professional athlete. Right, because you're not going to win all the games, and you're not going to make every free throw. And Michael Jordan said he missed way more shots than he made, and yet it's the greatest of all time. Right. Questions?
I think a part of my brain too is, the quick fix, right? It's so much, I really struggle with and it's really all I've known for a long time because I didn't have, the resources or had not the people around me to put me in the right kind of therapy that I needed for a long time. And so it became like this quick fix to just shut it down, right? For today. Cause I can't deal with this today. My brain is just going crazy, right? I'm having all these thoughts and just going through all this, just this I can't escape. I don't know what to do. And my brain tries to stay away. It scares me, this long road of healing, and I've gone out with EMDR and it's helped me tremendously. Right. But I think that's a part of the fear that how long is it going to take? Right. Is it going to be worth it on the other side? Right. Because I think the stimulant or, the things that I've relied on have warped my brain into becoming, you're right, poison's devil, right? Saying, oh no, it's easier, right? It's easier and you'll be fine. And, it's not worth it on the other side. It doesn't matter. I can just give you a dopamine right now or just calm your brain down right now. Right. How do I even go about that if with the thoughts, yes, of every day, but it's something that's been ingrained in what I do every day, right? That decision to just, it'll be today and I'll go tomorrow and start tomorrow my mental health journey, right? Do you have any advice for that?
Did you ever listen to Hardy, the country singer?
I've heard of it. Yeah.
Yeah. He's got a song called Jack.
Yeah.
Yeah. You want to listen to it. It's so good. I love this song. And it's just about that. Mm-hmm. It's like, hey, I fixed you. Mm-hmm. Even though everybody hates you, but I fixed you.
Mm-hmm. Yeah.
Yes, I think you have to have mantras in the moment. Mm. What do you want? If I asked you that, what do you want?
I think peace,
Peace.
Peace, yeah.
Yeah. Is a quick fix going to give you peace? Is that your experience with the quick fix?
Peace in a different, it's somewhat. Yeah. It's I think quiet is a better word for it. Quiet.
Okay.
Yeah.
So you probably have to up the libido to calm down this very busy brain of yours, right? If I was your doctor, I'd go, okay, what's your level? Mm-hmm. And you might need, because you're a big girl, you might need 600 milligrams.
Mm-hmm. Yeah.
So you never want to get away with the least amount of medicine. Mm-hmm. You want to go, what's right for my brain? Mm-hmm. And when it works right, you're going to notice it's just quieter inside. And you always want to feel better fast in a way that lasts. Mm-hmm. So GABA calming. In the moment, that might calm it down. Or we make something called theanine gummies. That might calm it down. Mm-hmm. But you didn't learn to be a great basketball player quickly, right? Mm-hmm. And if you want to get on top, I'm not a fan of bipolar or borderline personality disorder. Mm-hmm. I would lose that diagnosis. It's completely unhelpful.
Yeah.
I think bipolar II, I sort of see that. Mm-hmm. Plus post-traumatic stress disorder.
Yeah.
Those would be the two, based on your scans, I would hold on to. Mm-hmm. And so I'd get my Lamictal to a therapeutic level. I'd keep with the EMDR. I would add, start journaling your thoughts. Mm-hmm. And if you do this process that I have on just 30 thoughts, your brain will start to do it by itself. Mm-hmm. But you have to initially, let's take a bad thought. What's a bad thought that's going on?
I'm going to get re-injured.
I'm going to get re-injured.
Yep.
Okay. 5 questions. Mm-hmm. Is that true?
No. We don't know.
I don't know.
Yeah, don't know.
Right? I mean, you're a professional athlete. They get injured, right? Is it absolutely true? That's question 2. It's absolutely true you're going to get re-injured.
No.
No. How does that thought make you feel?
Anxious. Yeah.
How would you feel if you didn't have the thought?
Free.
Fine.
Yeah.
It's the thoughts that make you suffer. It's not what's actually happening. It's the thoughts that make you suffer. In fact, one of the things I would do is I would do EMDR specifically around, I'm going to be re-injured. And because your subconscious thinks it's protecting you with that thought when it's really hurting you. So I have a fun story. Alicia Newman is a Canadian pole vaulter, and she did my show just like you're doing it. And afterwards, I did EMDR with her, and she completely failed in Tokyo. She had a concussion. And then she went to Tokyo in 2021 and didn't even jump one bar, and got drunk on the plane home, and then DM'd me, and I saw her. And 2023, she was the world indoor pole vaulting champion because she got her brain right.
Yeah.
And then she went to Paris, but in February of that year, doing something stupid, like she was hurdling after her workout to just sort of wind down, tripped, sprained her ankle. And but she had disciplined her mind by that time. And she ended up, but that was the thought, I'm going to get re-injured. So we did EMDR on that. And of all things, minions came up in her mind as her subconscious. And they're like, well, we thought we were protecting you. And she goes, you're not protecting me, you're hurting me.
Yeah.
And she won the bronze medal in Paris.
Wow.
I'm so proud of her.
Yeah.
But it comes, you guys remind me of each other, that her brain was so busy. You can discipline this, because you're a disciplined person, right? I mean, you don't get to where you were if you're not a disciplined person, right? You have to discipline your mind. And so anytime you're triggered, I would take that to your therapist. But the fifth question, I'm going to get re-injured. Is that true? I don't know. Is it absolutely true? No. How does it make me feel? Scared, anxious. How would I feel without it? Peaceful. So it's the thoughts that make me anxious. Question 5 is, let's turn it to the opposite and just ask yourself. So the opposite is, I won't get injured. Do you have any evidence that's true?
Yeah. I mean, I've been playing uninjured now for 2 years.
There's a lot of evidence that that's true. So if you focus on, I'm injured, you're going to feel bad. Where you bring your attention always determines how you feel. And so if you focus on, I'm going on 2 years. Now, I'm not going to be stupid, right? You're going to be thoughtful as you play. You don't play with 100% abandon, right? Nobody who's been injured does that.
Yes,
right?
Right,
because you learn. Give me another thought.
Oof. I'm gonna think. There's a lot. I'm not gonna, I'm not gonna make my dreams come true. And I'm gonna be a failure. I'm gonna fail.
Is that true? And remember, this is not about positive thinking. It's about accurate thinking with a positive spin. I like the verse of the New Testament, know the truth. The truth will set you free. You're a failure. Is that true?
No.
Your 10-year-old self doesn't think so. We've already established that, right?
Yeah.
My dream won't come true. Is that true? No. Is it absolutely true? No. How does that make you feel? Awful.
Yeah.
Ashamed.
Yeah.
And how would you feel if you didn't have that thought?
Proud and
like, look at what you've done.
Yeah.
You have 2.4 million people who follow you, who are interested in you. So if we take that thought, my dream is not going to come true, and turn it to the opposite. My dream is coming true. Do you have any evidence your dream is coming true?
Yeah, I'm playing professionally, signing contracts and, making an amazing salary. I get to play in Athens, Greece this next season. So
are people go on vacation?
I get to live in downtown Athens for 7 months. Yeah. Not the worst thing in the world.
Playing the game you love.
Yeah.
Playing the game you're good at.
Yep. For an amazing amount of money. I would
do
do it for
you
free.
see how your brain is the one stealing from you?
Yeah.
It's your undisciplined mind.
Yeah.
That should piss you off.
Yeah. Like I've been cheated out of a lot of joy. I feel
Not
like.
so you kill yourself, right?
Yeah.
But so you go, oh no, I have to do the work.
Yeah. Yeah.
Because you're not afraid of work.
Yeah. Yeah. No, done a lot. And it's, it's paid off in dividends, right? But yeah, it's not talked about. It's not talked about, I think, the women's side.
I have a whole chapter. Give her a copy of Your Brain is Always Listening. There's a whole chapter on this ant killing stuff. And if you do nothing else from me, but stop poisoning your brain and kill the ants, you will love me for the rest of your life. That would make me so happy. I was 28 years old in my psychiatric residency when one of our professors said, you have to teach your patients not to believe every stupid thing they think. And I'm like, but I believe every stupid thing I think. There's nowhere in school where we teach people to manage their minds. And it's not pie in the sky thinking, right?
Yeah.
You're living your dream, right? I mean, maybe it'd be in the WNBA and that would be awesome. Maybe, unless you're on Caitlin Clark's team and they're so picking on that poor girl.
Yeah.
But
love her.
Right? I mean, fame gets you haters.
Yeah. Yeah. For sure. Yeah.
Right?
Yes, indeed. Yeah.
I have them too. I mean, like, who would hate me? I'm like the nicest person.
Yeah. And I can't blend in, which is the crazy thing too. I'm, born to stand out. So it's definitely different in the public.
You're born to stand out.
Yeah.
Good.
Yeah. That's crazy. That is a lot of.
We have to calm this thing down.
Yeah.
But it can be. That's the cool thing about your brain. It is imminently treatable. And so I would kill the stimulants, optimize the lamictal, start happy saffron, because I think you'll be happier. And come up with a list of 10 things that don't hurt you to calm you down.
Yeah.
Right. I'll give you 2. GABA calming, that'll calm you down. Theanine gummies. Have you ever been hypnotized?
No.
Oh, you totally should.
Yeah.
Oh, I think you should find a hypnotist that you like that just helps you with peak performance and helps you with anxiety. And so hypnosis can calm you down. I have an app called Brain Fit Life 5.0. You should download it. I'll have Natalie give you a code for it. There are 6 hypnosis audios, 1 for peak performance, 1 for sleep, 1 for anxiety, I think. And then so we have GABA calming, theanine, hypnosis. There's a breathing experience on it. If you learn to breathe in a specific way, that will calm you down.
Yeah.
So we're already 4 out of the 10.
Yeah. I love that. I've learned my last year of college was, I was 24, also playing with, I've been doing this for a long time of college basketball, but it was this, like, I need to start training my brain like a professional athlete, right? It was the last step in like my performance. And so I got a sports psychologist, and he has been like every day. I mean, went through a lot of like social media stuff and gained a lot of haters, right? A lot of hatred. And so that translated literally into going into basketball arenas and being booed at by thousands of people, right? While I'm playing the sport that I love, it's like the place where I come to escape, right? It's my peace, my safety. Basketball always has been. It's a place where I just get to go and just be me, be free, and do what I get to love and entertain people, right? And I mean, literally being booed by thousands of people, right? Thousands of people every time I touched the ball. It was a crazy experience going into that. And it was, how do I master this, right? Because, you know, I, for instance, played at Kansas State. And it was we had to win the game to like win the regular season for sure, right? To make the end of our season much easier. And went into their place. We hadn't played them yet. They were undefeated in the Big 12. We were undefeated, killing it. And I went in, and I kid you not, a sea of student section. Every time I touched the ball, right? It was the loudest. People said they could hear it to the TV. It was crazy, right? And the whole time I just was like, I just want to sink into the ground. Like, I just want to shrink and not be here, right? And just this is insane. And I told my sports psychologist, you know, we lost the game. I played horrible. I shot horrible. Every time I touched the ball, I was like, get out of my hands. But we had a game a few weeks later, we lost. So, okay, now we have to win out, right? We had a few games a week later. It was the last game of the regular season at Baylor, who we had just beat them for the first time in 31 years in school history. Which you play them twice a year. It's about 68 games of never beating Baylor in TCU history. And we just beat them on our home court a couple weeks earlier, right? And so I said, I'm going into Baylor in a few weeks, and it's going to be worse, right? Their student section is going to be crazy. It's packed out. I broke my finger in the arena last season on Baylor's home court. How do I master this? And we worked every single day on breathing, on being present in the game, right? On facing it, right? Turning to the crowd and looking at these people, right? Not shying away, not being scared, but facing it as these are human beings, right? They can't hurt me. They don't know me. And just having this alter ego, almost like embracing it and being like, yeah, like, let's go. And in the first, I think 10 minutes, I had like 12 points, right? And just went off, and it fueled me, right? And so that was my goal, is and we won the Big 12 season on that game. And it was just, you know, that moment of, it taught me like, I can really put my mind to anything I want to. It was my thoughts of like, oh, I'm small, right? And it translated into me playing horribly and like throwing the ball out of bounds and doing things I'd never done before. And then instead of like for weeks being like, I have a goal, I'm going to achieve it, and I'm going to work on it, and I got it, right? It was my test. And it was amazing. I passed, and it was, you know, it gave me so much more confidence.
So I want you to do that in your real life. But in your sport life, I want you to have an alter ego.
Yeah.
You maybe even want to work with Todd Herman. I think it would be a good investment. And he's got like a course online, The Alter Ego Effect, or alteregoeffect.com. Because when you bring your amazing mind, you do amazing things. When you bring the scared little girl who's been hurt and traumatized, you do terrible things, right? But ultimately, you have a choice of how you show up. And alcohol feeds the fear, and kratom feeds the fear, and marijuana feeds the fear. And it's like, no, you want to face the devil. And you want to like use the energy to be great. Because your goal is to be great. Right?
Yeah.
And you won't ever do that if you don't discipline your mind. But you can see, I mean, that's just such a great example of, you allowed them to bully you and you played terrible. And the bully showed up and you punched him in the face and you played great.
Yeah. It's easy to think of it like it's my job, you know, and it's so easy to be like working at basketball, right? Because it's like a step outside of my, you know, it's a different version of, you know, the person I am every day. I go home and it's quiet and it's, nobody sees that, right? And it's something, basketball is somewhere where it's so important to me. It's something that's almost easier to like work on it and pinpoint focus on it.
Yeah, but you want to love yourself.
Yeah, that's the most important.
Outside of it.
Yeah,
I mean,
exactly.
you want to love it for your sport, but then you want to translate it to who's the alter ego you want to show up at home.
Yeah, exactly. Yeah. Never focus on like that. That's the most, it's also affecting basketball too.
Right. I mean, Kobe Bryant, when he was a dad, was not the Black Mamba. He goes, that wouldn't worked.
Yeah.
Be sneaky and hurt you. No. But figure out who you want to be in all of these situations.
Yeah.
What a joy.
Yeah.
Such a joy to meet you.
Ditto.
Autism. What is it? How do you know if you have autism's not one thing, it's many different things. There's so much to know about autism. It's not hard to understand. Hi, this is Dr. Daniel Amen. I'm so excited to tell you about our new course, Healing Autism, a new way forward, that I did with my friend and really autism expert, Dr. Jerry Cartzenell. It's a completely new look at autism. This course is for parents of children or adults who have autism, but it's also for professionals. We hope you'll join us with Healing Autism, a new way forward.
You have been listening to Change Your Brain every day with Sedona Prince. Thank you so much for sharing. Leave us a comment, question, reviews, subscribe. We're going to follow her career together.